Kara Welke. I've been an occupational therapist since 2000, and we have a great team of therapists that specialize in working with clients with dementia. We ideally like to get to people as early as possible with any sort of diagnosis of cognitive impairment, so we can best help them and their caregiver. My practice covers Grand Forks and East Grand Forks and the surrounding areas. Megan Dooley with Innovative Health covers Bismarck, Mandan, and then we all do telehealth. And then we work with therapists across the United States that do similar things that we do. So there is a lot of help and people out there that specialize in this area if this is a need for you guys. So let's get started. So today we're going to talk about navigating nutrition and mealtime for people living with dementia. So we have quite a few objectives we're going to cover in this brief time. We're going to discuss why difficulties with eating may occur and common barriers to adequate nutrition for individuals with dementia. We're going to identify consequences of inadequate nutrition. We're going to talk about how you can create a supportive mealtime environment. We're going to talk about use of practical strategies for encouraging eating. And then we're also going to address how to manage behaviors during mealtime. So first of all, there are a multitude of different ways that difficulty with eating may occur when someone has dementia, whether it's from difficulty recognizing, holding, or using utensils, just being confused as what to do, something that seems so easy for us to pick up a spoon or a fork or to grab a sandwich may just not be there for someone with dementia. They may have difficulty communicating needs, like if the food is too hot or cold, or they do not like certain foods. And we'll talk about this, and I'm sure that's already been mentioned, but just the whole taste really, can change as well. And an example, when we talk about like health related factors and so forth, pain, fatigue, poor vision, but one of our clients was having hallucinations, and she had hallucinations that when she was eating, there were little bugs crawling on the table. So again, how can we best help her to eat when something that should be, a happy time or enjoyable time to eat was not for her because she would have hallucinations and she thought little bugs were crawling on her food. Other things such as poor vision, not being able to see where the food's located on the plate, just plain old too tired to eat. Rushing mealtime routines. So we see this a lot as therapists going in and working with clients that, ideally we want our clients with dementia to be able to eat and do as much as they can by themselves. But we live in a world that everything's rushed, right? We have no time for anything. And when that carries over into a situation when someone has dementia and is trying to eat, it can really create an unpleasant meal environment for the person with dementia. Unfamiliar or uncomfortable environment. Reduced appetite, due to medications, changing in eating routine. We see a lot of clients that really do have a big problem with reduced appetite. Also just feelings of frustration or failure, and these are just a few of the things that can lead to difficulties with eating. Some common barriers that we see, and this kind of extends from this a little bit, but cognitive decline, may just forget about mealtime. So we have clients that are able to live on their own yet, but they might forget to eat or forget when they last ate. And they're not realizing when they should eat because they don't have, they don't have the hunger feeling that they used to, or food doesn't taste good anymore. So they might go a long time without eating if there's no one in there to help them. Also with cognitive decline, just difficulty following meal preparation and, even frustration with cooking, especially if it was something they really enjoyed to do. And now they're having difficulty completing the process. Loss of appetite. So we already talked about that. Between the taste and smell being affected. And I don't think the sense of smell is talked about probably enough. We do talk about the taste, the sense of taste that is affected, but the sense of smell has a huge impact as well. And then, as I know Nicole talked about this morning, swallowing difficulties, increased risk of choking or aspiration, is a huge barrier. And dental issues. We see so many people that have improper fitting dentures, missing teeth that have never gotten their teeth taken care of, having difficulty with chewing, swallowing, pain with chewing and swallowing. So lots of barriers that can make the mealtime routine a pretty rough situation. More things that can be barriers, changes in motor skills, just the decline in gross and fine motor skills that can make it difficult to feed oneself or use utensils. And we want to try to find a way, if one of the barriers is literally just difficulty using a fork or spoon, what can we do to make that easier? I mean, it's fine just to use finger food, make things easier. We'd much rather use that. So we are teaching that, or continuing on with what they've always done with feeding themselves versus having someone else just feed them. Digestive issues, GI problems are huge, constipation or reflux issues. We see GI problems a lot with several of our clients. It does have a huge impact on their eating behaviors. And then again, medications. There is a huge issue with polypharmacy. I can use my dad for an example of this. We've been trying to get his pharmacist drugs reduced and working with their physicians for forever and not getting done. And just recently, finally, a physician was like, yeah, he has massive polypharmacy. And, all of those medications that he was taking, lead to different things such as loss of appetite, nausea, dizziness, things like that. So medications, depending on what they're taking, can be a big barrier. Depression and anxiety. We see clients that, yes, they have cognitive impairment, but sometimes the depression and anxiety are almost bigger barriers to many things that are going on than the cognitive barrier. So what can we do to help with the depression and anxiety that's going to help them enjoy the mealtime, eat better, get the appropriate nutrition that they need. Lack of awareness. I mentioned this a little bit earlier, but may not recognize importance of proper nutrition and may forget to eat. So again, we see that a lot of times. Resistance to caregiver assistance. So how many caregivers on here, and you can just put this in the chat, have difficulty when you're trying to help someone with eating and their resistance to you helping them? We see this a lot. And another thing we see is that a person might be okay with like an outside caregiver, but they are really resistive and don't do well with maybe, their spouse or their son or daughter that are helping them. Okay, now we're going to talk a little bit about the consequences of inadequate nutrition, which I realize you guys probably had discussion of this, so it's probably a review. But again, it's so extremely important because when we're able to get in there and figure out what the barriers are that are leading to the difficulty with meal times and so forth, and we can help improve their nutrition intake, it makes such a huge difference. So weight loss, these are all pretty common sense, right? Weight loss leads to weakness and increased susceptibility to infections. Also, with that weakness, then we're getting into the falls and decline in them being able to do their daily ADLs. Even weight loss, when it leads to weakness, can also lead to difficulty with using their utensils to eat. They just don't have enough energy to feed themselves. Malnutrition, if the body does not get the necessary vitamins and minerals. Weakened immune system, more vulnerable to infections, illnesses, and complications. Cognitive decline. So again, if they're not getting the proper nutrition, that's huge because it's essential nutrition plays such a huge role in maintaining brain function. So again, you see how it creates a vicious cycle, right? And I already mentioned on the page before, increased risk of falls and fractures. A decline in physical strength and balance increases the risk of falls and fractures. Deterioration of muscle mass. Oops, have an extra M there. So lack of protein intake can lead to muscle weight wasting and weakness. And just to touch on it a little bit here, and this is the important part why businesses like us that really focus on not just, OT with the cognitive side, but also the physical therapy that comes in and works with clients on maintaining their muscle mass, maintaining their strength is huge. But how far are we going to get if there's inadequate nutrition in place? So that's why it takes, a team approach to really help the client and caregivers through this process. Dehydration. So we see this a ton. I feel like I say that a lot. But, UTIs, we see way too frequently. Dehydration is huge. And, it might be something as simple as literally just placing their favorite mug or glass or something in front of them so they know to drink. Way too often, we go into places, whether it is their own home or an assisted living or a skilled nursing facility or a rehab and so forth, and there's no water within reach, and they're may not remember to ask for water or something to drink. So, making sure that they're being hydrated and getting enough water is very important. Inadequate nutrition can actually lead to decreased quality of life. If you don't have the nutrients you need, you might feel like crud, be uncomfortable, you have poor energy, so again, you think about, you already have some cognitive impairments. You already don't really like to go out and interact with others because you're not remembering and thinking and processing like you used to. And now you feel like crap too because your nutrition intake is very poor. Agitation and increased behaviors. So one thing that I would like to stop is a lot of times we don't get called in to a situation until it gets to this point, until there's agitation and increased behaviors. And ideally, if we could start, working with clients and caregivers as soon as there's a diagnosis, we can really create a plan to help minimize all of this. But this is one common thing that we see a lot is we get called in when there's more behaviors going on during the mealtime, there's more agitation and so forth, which makes the situation not good for the client, and it doesn't make it good for the caregiver, right? So, and why does agitation and increased behaviors happen? Well, it can happen for numerous reasons, but hunger or discomfort from nutritional deficiencies can contribute to irritability, restless, and behaviors. But the agitation and increase in behaviors can also come maybe from the caregiver and how they're responding to different things. It could also come from the environment as well. So it might not be directly from the hunger or discomfort from nutritional deficiencies. Complications with medications. So this is another one we see quite a bit. So we provide therapy in the home. We're not a home health company. We're an outpatient, just like people would come into an outpatient clinic, but we go to the home. So one thing we see a lot is everyone's medications and how are they managing their medications. And often it's not very well. I'll even admit for myself, I'm not the best at medication management for myself. But when we go into the homes, oftentimes we see multiple bottles of medications. Maybe they'll have something to help, like a pill box, maybe not. I've had several clients that use little cups and kind of set it out. So things just aren't getting taken, or their medications aren't getting taken. One, they're not getting taken at all. Two, they might be being taken in the morning when actually they're supposed to be prescribed, or they're supposed to be taken at night. Or maybe they're not being taken with any food and they're supposed to be taken with food. Or maybe they're being crushed and that kind of medication isn't supposed to be crushed. So I highly encourage everyone to get a medication reconciliation, whether that's with a pharmacist or you have therapists like us that kind of specialize in coming in and doing medication reviews and analysis to help work with your pharmacist and doctor to make sure that everything is being taken at the proper time, with or without food, and again, whether it can be taken crushed or liquid form and so forth, because it can really affect the efficacy of medications and lead to a large variety of issues with that. So I'm going to stop there before we go into now how do we really help create more of a supportive mealtime environment and talk about more positive things here. And just check out the chat section to see. So questions for you guys. So I see we have a few people that responded quite frequently. Mom's a picky eater, due to having gastroparesis, on top of memory issues. Yeah. So for those caregivers that are on here, I'd love to hear from you. Out of the different things we've talked about thus far, what are you seeing the most that's making mealtime difficult, eating difficult? And even those of you that work in facilities or work with, in a nursing home or assisted living, or, what do you guys see out there that are really making things difficult with eating? What do you feel are the biggest barriers? Want to make sure you are not all sleeping. Anyone have anything to add to the chat?
I was going to say that my mom is the one with gastroparesis, and she gets full very quickly. She has teeny tiny, what I call bird meals. And it was really interesting to hear you and the speaker before talk about how they like sweets, because she can eat a cookie almost any time. But trying to find, I still haven't found a protein shake she likes.
Okay, well, hopefully, as we go through this next section, we can try to find some other alternatives that may be helpful for her. Um, so Nancy said forgetting to eat is something that she sees. And Nancy, does she live alone, or does she, or he, or she, do they live with someone else? Erin mentioned as an RDN who worked for years in long-term care, not enough hands to help residents eat. And it's almost a whole different ballgame, right? When we're talking about helping increase nutrition for someone in the home environment versus increasing nutrition and meals for someone in a nursing home, an assisted living facility, and what we could do to really try to change a bigger environment versus the smaller homes. So it'd be interesting, Erin, if you guys tried anything over the years that you found that helped. So Nancy said her individual lives at home. Let's see, make sure. I support caregivers. Two things: not interested in eating, not eating much, and water. He minimizes her water intake because of incontinence. That's another huge one too. People think that they're incontinent, or they're going to the bathroom too much, so we're going to minimize the water intake, right? Yeah, not good. Not eating on a regular basis, even though diabetic, eats sweets, no appetite, forgets to eat, doesn't understand healthy eating. Having the right staff wanting, willing to take the extra time to help feed. Yeah, huge. Really educating caregivers and staff in facilities is another big one. The cost of good foods compared to quick, easy meals. Lorelei, that's a huge barrier right there. Definitely need to add that in. So, and yeah, turnover in staff affecting routine. Time. I mean, this is what I see all the time, whether it's in a person's home or it's in a skilled nursing facility, or whatever. Everyone's always rushing, right? We have a new client that we've been working with, and she can feed herself, but staff are just doing it for her, and I'm like, what else do you have to do today? Nothing. You're here for her, so give her the time so she can do what she can herself. So I mean, why are we in a rush? I mean, I realize in a long-term care and some of these other facilities, there's different situations at place. So, okay, great. Awesome. So we'll go back and then we'll come back to this, because I love hearing from you guys. You guys all have great ideas and things that have helped you over time as well. Okay. So, whoops, go back. Creating a supportive mealtime environment. So routine is key. And I'm sure many of you guys on here, probably every single one of you on here, have been preached over and over that you need to have a set routine and how important a routine is. And you're going to hear the same thing for me. Routine is one of the most important things that we need to get in place. And I will tell you being a caregiver is it's probably the hardest job out there. I know that. But what we find is we'll go into a home and the caregiver will talk about routine, right? And the caregiver will say, well, some mornings they may get up at 8, some 11, sometimes 10. But they're like, I like it when they sleep in because then I can get stuff done, but that mix of times and Getting up one day at 8, one day at 11, next day at 10 can just lead to chaos, right? So we really work on establishing a solid routine. And in that routine is regular meal times. And whether it is a little tiny, I like the bird meals that you noted, but regular meal times are huge. They create a sense of predictability, and it helps them know, just kind of be ingrained that every time at this time I'm going to eat. And it's important to follow this routine daily. And yes, we also want to try to get people out in the community and so forth. But as much as possible, if you can create a set routine where, every morning, this is what time breakfast is, this was time lunch, this is what time supper. And then if you throw in that mid-morning snack, that mid-afternoon snack, is great, but keep it consistent. And try not to change that time, location, or sequence if possible. Even down to using a consistent seating arrangement and utensils and plates. Because if it's all the same every time, they're going to get used to that, right? Versus sometimes people are sitting over in their recliner eating, or they're, laying on the couch or in bed or in the chair. We love it if you can get them out of the dining room chair into the kitchen, sitting at the kitchen table and eating, and you have it set up like a normal meal. So think about what life was like before the cognitive impairment. How can you make it as normal as possible and follow that routine? Also creating a calm atmosphere, reducing noise and distractions, using soft lighting, no TV on. How many of you guys sit and eat in front of a TV or with multiple distractions going on? So we want to try to minimize that and create a nice calming atmosphere. And again, following that routine. There's also research out there on utilizing music during meal times and how that can help with increasing nutrition intake and so forth. But it's not going to be loud rock and roll music, right? It's going to be nice, soft, relaxing music or something that they enjoy. So two key things: establish a routine and create a calm atmosphere. I would love to know, for those of you that are on here, and you can just either put yes or no, no judgment either way. Do you feel you have a solid mealtime routine, and do you create a calm atmosphere for your mealtime? Put yes or no. I can tell you that 99% of our clients, when we go into their home, would probably be no answer to both of those. Okay, more ways, and I'll come back and look at the chat later. Creating a supportive mealtime environment, remove clutter. So where they're eating, and again, we really would love to get people out to their dining room table and reduce clutter. Try to keep it as minimalistic as possible. So food is the central focus, right? Personalize the space. Can you use familiar tableware? Can you set it up how the person likes it? I mean, my son's 17 years old, and he has a certain place he likes to sit and certain things he likes when he's eating. I grew up on a farm. I mean, we had set spots where we ate every meal and so forth. So a lot of people have those routines. Can you carry that over now? Adapt the environment. So there are a large variety of adaptations that can be made to help with eating, whether it's non-slip placemats, it's special utensils, plates, bowls, so forth. Again, I wouldn't go out and buy all these things. I would get a therapist that specializes in this to come into your home and help you find the best alternative, but there are a variety of alternatives out there to help. Encourage independence. So again, I'm all about independence. We need to slow down. We need to take a deep breath. We need to have patience and not be in a rush during mealtime. And we need to allow everyone the time to eat by themselves. And whether that's using adaptive utensils or whether that's using their fingers to eat, that's huge. There was this magnificent picture that was actually on social media recently, and it was of one of our clients and in a facility, and she was participating in a baking activity, and the smile on her face said it all, right? So if you can have them help, if making meals, and so my husband, my dad, participating in mealtime prep would not be something I'd recommend for them. But if they are somebody that love to cook, love to bake, getting them to participate in the mealtime prep, again, is huge, and it can help them carry over with eating the food as well. Promoting social interaction. So making sure that you are eating with the person, or they have someone to eat with. Who likes to sit and eat by themselves? I admit that when I'm working from home, I'm probably the worst at taking the time to go and eat and so forth. Use a mealtime as a time to sit together and have social interaction and create a nice, relaxed environment for them. Visual and tactile cues. Contrasting plates and mats to help with recognition. Think about plate on tablecloth as well as food on plate. So I put a link at the end of the presentation on a study with like the use of a red plate. But again, like you see the lady that is eating, she has a white plate and oatmeal in there. You can't, it's not a big enough contrast with what she's eating. The plate above, the broccoli, I don't know if that's squash or what that is, and the tomato all have great contrast, but the white blends right in, so same thing with like mashed potatoes on a white plate. Sometimes it might be visual problems that are leading to eating. So making sure you have contrasting plates, mats, and so forth, so things are very easy to see. Mindful of temperature. Again, make sure the food is served at appropriate temperature. Sensory sensitivities. So we have clients that are very sensitive to different types of textures or smells or colors. And it literally might be something that has developed, more recently. They might not have had it their whole life, but it's really impacts what they do and do not want to eat. So really sitting down and figuring out what that is so you can modify that diet to best support them. And I'm guessing all of our dietitians in here are be very great in helping with that. More things. So again, flexibility and patience, being patient and allowing ample time. Already talked about this. Monitoring hydration. Just there's not enough fluid intake out there. Having conversations. So when you are sitting there eating with them. Okay, and the other thing is caregivers, when I say visiting with them during mealtime, it's sitting down eating with them, not like cleaning up the kitchen and talking to them, right? You need to be sitting down or nice, relaxful conversation and with them when they're eating and trying to eat at the same time. Dignity and respect, making sure we are still respecting their choices and preferences and allowing them to maintain a sense of control. So we'll continue on these are some more practical strategies for encouraging eating. So again, one of the key things to do for encouraging eating is to create a supportive environment. And that's everything we've talked about already. So if you ask me for practical strategies, we would talk about the environment first. Then, these are some other ones that can make a difference to encourage eating. So when you are offering food or drink during the day, how do you present it? Do you, do you have a drink and offer it to them and say, hey, George, here's your drink of water, or do you just set the water next to them? How are you offering that? Can we smile more? Can we be more uplifting in offering them food or drink? Again, finger foods, nothing wrong with finger foods. I'm guessing all of you dietitians, it would be fun for you to list in the chat your favorite finger foods that are bite-sized and more nutritionally dense to help those that are attending today. I like to make sure we use our dietitians to help us with all of this, but finger foods are okay. Eating with hands is okay. If they're eating, that's what we want. If they're getting good nutrition, that's what we want. I'm so going to use the birdside meals thing, but small frequent meals is fine as well. Can we do more frequent meals over the course of day rather than, a big plate of food that's literally they're going to look at and they're going to say, I don't want any of it. Appealing presentation. So again, presenting food in an attractive and visually appealing manner, using colorful plates and garnishes. How can you kind of doctor the plate up? That's not going to really take you much time, but it's going to make it look even more appealing to eat. So we talked about encouraging independence. So if they do require assistance, if you can sit on the dominant side next to them, and again, if you can eat while they'll eat and then offer assistance as little as possible and try to encourage them to participate as well. So even providing the hand over hand assist. So like in this picture, she's not providing hand over hand assist. She's feeding the person, but she is sitting on the right side, the dominant side. Well, I guess we're pretending her right side is right foot side. Use familiar foods. If you can sit down and make a list of all of your loved ones' favorite foods, that would be huge, and have that list there for the dietitians and for the therapists and people you're working with to help you figure out a good strategy. Use aromatherapy. I really don't like having two screens because I miss all the chats, but I'm interested to know if any of you guys use aromatherapy. So aromatherapy can be wonderful. I think Sarah, one of my therapists, is on here, and she didn't use it necessarily for a mealtime thing, but she's used aromatherapy recently with a couple of our clients, and it's crazy how well it has worked. Soft background music, like we talked about a little earlier. Choices. So choices can be, some people have different viewpoints on offering choices, right? So offering, some people say offer one item at a time to decrease confusions and limit choices so it's not overwhelming. Other people say at least offer two choices. But again, it's going to be a case-by-case situation. If offering, do you want this one or this one, and it makes them more frustrated, then you're not going to offer them choices, right? So that can go either way. Give snacks with medications. Again, depending on the medication and what you can or can't do, if you need to crush it or give it whole or liquid. Some medications you give with food, some you don't. But, sometimes people will say, like, you need a few bites on top of your medication so you don't get sick. So they're kind of utilizing the medications to help get some nutrition into their body. thinking outside of the box, are there alternative types of food that they might enjoy eating? And again, dietitians out there, I'm sure you guys have a variety of alternative type foods that you recommend, but um, we've done like making pureed fruits or yogurts and put them in like a kid's popsicle containers to make popsicles with more healthy types of foods in there. Relax the rules. It is okay to prepare the same food over and over. And it's okay if not everything is eaten. The goal is to get as much nutrient rich foods as we can. But if they're not going to eat anything versus they're going to eat the same thing over and over, what are we going to choose? Caregiver communication. So one thing that we do when we go in is we use a triadic model. So when we go in and work with a client with dementia and their caregiver, we look at the client with dementia and we look at the caregiver and we look at the environment, because all three of those have an impact on what's going on. And sometimes it might be the caregiver's way of communicating with the client. Do they argue or rationalize? Are they rushing? Are they kind of crossing their arms, or are they increasing agitation and so forth? So it may be just working with the caregiver on helping improve their communication style during the eating routine. Okay. Well, I think we're to the last one or close to it. Now we're going to talk specifically about managing behaviors during mealtime. Again, this is not a one thing fixed all. Ideally, if you guys are having troubles and behaviors at mealtime, if you can bring in a therapist to help you, it's covered by insurance. We're here to help solve the problem, and then teach ways that you can really manage and overcome these barriers. So that's where I talked about, we utilize the Skills to Care program. It's an evidence-based program out of Thomas Jefferson University, and they use that triadic model. And for each and every person, something different is going on. So ideally, when we can get into the home and look at the home environment, the caregiver and the client, then we can best help and work with the client and caregiver to solve those problems. But if you utilize the tips for the supportive environment that we talked about, and you utilize the tips for encouraging eating we talked about, those are going to definitely help. Some other things I just wanted to add, physical comfort, if they're having behaviors, make sure you're checking for pain or discomfort. Something could be going on. Timing, make sure you choose optimal time for meals when a person is more alert and less fatigued. And make sure you're doing positive reinforcement, praise and positive feedback. Monitor for hunger or discomfort. The more and more you really are attuned to your loved one, to the situation, you're going to be able to identify signs of hunger or discomfort. Remain patient and calm. And I know that's tough. Sometimes, some of our caregivers just literally have to leave the room and go and take some deep breaths and then come back. Or count to 10 and then respond, because when we react negatively, that can just further agitate and increase behaviors. The other thing is, I hope all of you have a journal. Make sure you are documenting everything that goes on. We love to have a document on a journal for every day. What time was what time they get up, what time was breakfast, what time was meds, all of that. And then if there's behaviors, sometimes there's things that we can kind of track back and figure out, okay, the behaviors are happening during this time after this happens, and then we can help figure out a way to help overcome that. Gentle redirection, again, using positive language, avoid confrontation. Gentle redirection, gentle touch can be calming and redirect attention. And if you can model the desired behavior is helpful as well. Important tips. I feel occupational therapy is very underutilized in the area of helping with mealtime, just with clients with dementia, caregivers, and so forth. That's why I'm super excited that we have, quite a few providers in the state and surrounding states that are skills to care providers. And they're able to come in and help customize a plan for each individual person and their caregiver and the environment, which ideally is what's often needed in many situations as well. So if you have any questions, you can always feel free to reach out to me. So with the references and so forth, I use a lot from our Skills to Care certification. I personally like Gitlin's and Purcell's Caregiver's Guide to Dementia paperback. It's a really simple, easy to use book. I have had one caregiver in all my time not like it, but the majority of them like it. This Out of Sight, Out of Mind. It's older, it's from 2010, but it's a good talk about like the using of the red plate and so forth with mealtime.